Meet Sarah, a 25-year-old female presenting to the emergency department with palpitations, dizziness, and also near syncope. She's otherwise healthy but reports these symptoms worsening during physical activity.
Okay, hi Sarah. Why do you come to this emergency department?
Hi doctor. Sometimes I feel like my heart is racing and sometimes I feel so lightheaded like I'm gonna faint.
Alright, let's first check your ECG. Come with me, Sarah.
Alright.
So, based from your ECG, it shows a narrow complex tachycardia and delta wave, suggesting Wolff-Parkinson-White syndrome. So, we need to stabilize your heart rhythm. So, based from this, you can see.
So now, let's understand better about Wolff-Parkinson-White syndrome. Etiologically, this syndrome arises from the fusion of the ventricular pre-excitation through an accessory pathway and normal electrical conduction through atrioventricular node. This accessory pathway develops from myocardium chamber due to an abnormal folding of the atria and ventricle during cardiac embryogenesis. In examination, the Wolff-Parkinson-White syndrome will portray an abnormal ECG pattern caused by an abnormal electrical pathway in the heart that bypass the usual electrical conduction via the accessory pathway. This accessory pathway allows the electrical signal to skip the delay of 0.001 millisecond at the AV node, causing an early activation of the ventricles. This pre-excitation creates a unique ECG pattern with a short PR interval due to the bypass of the AV node delay and a delta wave, which is slurred in the beginning of the QRS complex caused by a slow, early depolarization of the ventricles through the accessory pathway. So how does the accessory pathway cause the WPW syndrome? Firstly, this accessory pathway will help in triggering and maintaining the arrhythmia by the re-entrance of the circuit that forms between the normal electrical impulse conduction system and accessory pathway. Secondly, this pathway will also conduct the arrhythmia from elsewhere, which means the accessory pathway can transmit a fast arrhythmia directly to the ventricles by passing the normal pathway, which can lead to a rapid ventricular rate, increasing the risk of the dangerous rhythm like that can be seen in the ventricular fibrillation or cardiac arrest.
Now, let's discuss the management and contraindications in the Wolff-Parkinson's-White syndrome. For stable tachycardia in the Wolff-Parkinson's-White syndrome, the management will be by using medications like procainamide. Procainamide is a class 1 antiarrhythmic that works by slowing conduction through the accessory pathway and restoring the normal rhythm of the heart. However, some drugs are contraindicated in this Wolff-Parkinson's-White syndrome. For example, calcium channel blockers like verapamil and also digoxin. Why these drugs are contraindicated is because these drugs enhance the conduction through the accessory pathway bypassing the AV node. This can lead to rapid ventricular response and life-threatening ventricular fibrillation.
Sarah, I see you are taking fluoxetine for depression. This could affect how we manage your arrhythmia.
Why doctor? Is fluoxetine dangerous for my heart?
Fluoxetine is a CYP2D6 inhibitor. It will slow down how your body processes certain drugs, including antiarrhythmics. This can lead to higher level of drugs and increase the risk of serious side effects or toxicity.
Yes, it also raises the chance of a dangerous condition called QT prolongation. We will choose safer options and monitor your heart to speed.
Got it, doctor. I will be sure to, after this, inform you all the medication that I take after this.
Miscellaneous drugs like adenosine, digoxin, and also atropine.
So Sarah, for cases like yours, we often use adenosine. It is very effective for treating supraventricular tachycardia, SVT. So adenosine works by temporarily blocking electrical signals through the AV node to stop the abnormal rhythm.
I see.
Seems like Sarah is a bit confused. Let me explain what's going on.
Now, let's explore the mechanisms of a few important cardiac drugs, focusing on adenosine, a class 5 antiarrhythmic drug, and its role in treating supraventricular tachycardia. Adenosine is unique in its ability to act quickly to terminate re-entrant arrhythmias. Adenosine opens potassium channel in cardiac myocytes and pacemaker cells, increasing the outflow of potassium ion. This causes hyperpolarization, making the cell more negative inside. The resulting hyperpolarization slows conduction through the AV node, disrupting re-entrant circuits that causes supraventricular tachycardia. Now, let's explore the mechanisms of a few important cardiac drugs, focusing on adenosine, a class 5 antiarrhythmic drug, and its role in treating supraventricular tachycardia. Adenosine is unique in its ability to act quickly to terminate reentrant arrhythmias. Adenosine opens potassium channel in Adenosine inhibits L-type calcium channels in the AV node. By reducing calcium influx, it slows conduction further and decreases automaticity in the AV node. Adenosine's rapid onset and short half-life make it highly effective for acute management of supraventricular tachycardia. Now, let's look at other class 5 antiarrhythmic drugs that are commonly used. Digoxin. Digoxin works by increasing vagal tone, enhancing parasympathetic input to the heart. This slows the heart rate and prolongs conduction through the AV node, making it useful in managing atrial fibrillation with rapid ventricular response and certain cases of heart failure. Atropine. Atropine blocks parasympathetic signals by inhibiting muscarinic receptors. This encounters bradycardia by increasing the heart rate and improving conduction through the AV node. Now, let's look at other class 5 antiarrhythmic drugs that are commonly used. Digoxin. Digoxin works by increasing vagal tone, enhancing parasympathetic input to the heart. This slows the heart rate and prolongs conduction through the AV node, making it useful in managing atrial fibrillation.
But is there any side effects?
Yes, there are a few side effects. Adenosine can cause flushing, chest discomfort, or breathlessness, but these resolve quickly. Digoxin may lead to nausea or toxicity if not monitored properly.
So Sarah, with the right treatment and lifestyle adjustment, we can control your symptoms and prevent further episodes.
Thank you, doctor. I feel more confident in managing this now.